I'm Brandon Staglin, and this is One Mind Brainwaves. Thank you so much for watching and being with us today.
Hi guys, I have an incredibly exciting announcement to share with you all today. I'm collaborating with Little Words Project, a jewelry company all about spreading self-love and kindness. Each bracelet has a special message to remind you of how amazing you are. It's designed for you to pass on when you find someone who needs to hear that message too. As an advocate for mental health, working with a brand that focuses on the importance of positive words, it just felt like the perfect fit. In celebration of one of my favorite pieces from the collection, on Monday, May 17th, a portion of the net profits from the Grow As You Go bracelet will be donated to One Mind. I hope you love this bracelet as much as I do, and it reminds you to prioritize being kind to yourself and others always.
Trauma experienced in early life can continue to produce devastating consequences for mental health and even physical health as the decades go on. With us today are two amazing guests who are going to talk about how, with reliable interventions, people who experience trauma can actually go on to live more full and productive lives. Now, we'll be talking with an expert in the area of traumatic stress, who's actually helped thousands of people who've dealt with the conditions after trauma. The other guest is one of many high-profile athletes who's gone on to share their stories to kick the stigma surrounding mental health. Later, our One Mind Cyber Guide team will share about an app, the review of an app that uses an evidence-based game that actually helps traumatized children to heal. But first, her music is both beautiful and haunting and packed with sound. She's Alexander Petkovsky, a groundbreaking songwriter, performer, composer, and producer. And her artist name is, of course, FJØRA. FJØRA, thanks so much for being with us, and welcome to Brainwaves today.
Oh my gosh, thank you for having me.
It's an honor. Thank you. You're a classically trained pianist as well as a performer and so many other things. But your music is a captivating mix of the organic and the digital in the way it sounds. Did you set out to create a whole new sound in the music that you make?
To be honest, not entirely. I think because of my background of classical music and film score, like movie music, the cinematic and orchestral tendencies that are like strings and brass and, all that good stuff seeps its way into whatever I'm creating, compounded by the fact that I'm a piano player. So you're always going to hear like those acoustic piano elements anyway. And then my passion of electronic music merging with the cinematic. And I actually coined the genre cinematronic as a result. Cinematic, electronic, get it?
So that's wonderful. Yeah. So it is kind of a whole new innovation from you. That's amazing. And it's also cool that you do that cinematic music. I also have a love for that as well. Listened to a lot over the years on soundtracks and so forth.
Yeah.
Yeah. And you grew up in Toronto, Canada, and that's where you are now, you were saying?
Yeah.
Yeah. And a lot, I'm curious about who are some of your early artistic influences as you were developing a career there and beyond, and what inspires you now in your work?
I think my influences come from all sorts of things, but primarily definitely film composers and classical music composers. I think early on, like even in my adolescence, I was listening to like Danny Elfman and Thomas Newman, Philip Glass, all these amazing scores. Like if you've seen The Truman Show, from these types of movies. And then over the years, it's been, I try to keep the pulse on. So basically like who is composing right now and what are they composing? Right now, I'm really into Emile Mosseri. He's amazing. He did, I'm trying to think the most recent Minari, which is on the Oscar, buzz list right now, actually. It's phenomenal. So yeah, I try and I think it's extremely beneficial to be open and absorbent to fellow creatives around me anyway. And I think this transcends across not just in the music world, but every world. We better ourselves, we grow as human beings when we listen and learn from one another. So yeah.
Yeah. Wow. I love that philosophy. There's a saying that mind is like a parachute; it only functions when open, which I like to remember and try and live by. And but yeah, that's what I hope we can do by sharing your work today. That people listening out there can learn from you and from our webcast. So thank you for being here. And there certainly is a lot of drama in your music, and maybe that's imported from the cinematic world. But the song you're going to do today is an acoustic rendition of your beautiful song Limitless from your latest album, Onyx, which was released earlier this year. And it certainly has a feeling of like rising out of a dark place.
Yeah.
And yeah, so what was your vision behind this song and for the album?
So, just one quick little tweak. Actually, Onyx is a dark collection. I'm going to be doing an album, but it's 10 songs. And so it's not quite an album. And I don't want to put on the cap of it's an album. So it's my, dark collection. And actually, it was sort of one of those works where I really had this image in my mind of an onyx, which is a black stone, like a black diamond. And I was like, that image, how do we explore that in an emotional, sonic space? Because I think its prismatic beauty on the outside is very different from what's on the inside. And us as human beings, I think, can be reflective of that and exploring the darkness. What does that look like? What does that feel like? And so, yeah, Onyx was sort of a labor of love, exploring the darkness. Don't let like the cheery disposition fool you. I'm very, very dark and twisted. So I really have this fascination with it. So yeah, I wanted to explore it. And then Limitless was about one of those facets of the darkness when you think you've hit rock bottom, you're like the lowest of the low ebbs. And that's really when we can culminate, come together and rise above and push above. So yeah, that was sort of the, I guess, mental math behind the creative process.
Wow, what a beautiful metaphor. I love that, how we're deeper than we seem on the outside. And there's an endless potential. And when we get to, that rock bottom, we can only go up from there. There's a light ahead of us. Yeah, that's a great metaphor. I love that. Well, I'd love to hear that expressed in your song.
Yeah.
Can you please play Limitless for us?
Absolutely. Without further ado, this is Limitless. Buried in the chaos, cold as stone. Am I 6 feet under, or am I looking over? Body is breaking, fear to the bone. Ground below shaking, but a voice calls out. Ooh, I'll meet you at the edge of the world. Ooh, way above all the wreckage and hurt, because I am limitless. Will rise with tomorrow. I am limitless. This new revolution. Limitless, limitless. Limitless. I am limitless. Head above water, floating up. Can't pull me down now. Be free from the anchor. Invisible creature, tide turns within. Won't drown, I keep breathing. Find myself again. Ooh, I'll meet you at the edge of the world. Ooh, way above all the wreckage and hurt, because I am limitless. Will rise with tomorrow. I am limitless. This new revolution. Limitless, limitless. Oh, limitless. I am limitless.
Wow, what a song that is, FJØRA. Thank you so much for performing that. I love the lyrics. I love the feel of the song. And it brings to mind this another metaphor, another saying that I've heard before. It's like, when you're in a really dark place, you think you're lost. But the saying is, wherever you go, there you are.
Yes, that
And
is
you can
actually so true.
and you can find yourself in those dark places. That's amazing. Thank you, FJØRA.
Thank you. Yeah, my pleasure. My absolute pleasure. Thank you for having me.
With me now to talk about overcoming trauma and the mental health challenges and the stigma that surround it are Dr. Joan Cook, who is a clinical psychologist and professor of psychiatry at the Yale University School of Medicine, and Darius Leonard, a linebacker for the Indianapolis Colts of the National Football League. Joan and Darius, thank you so much for being with us today on Brainwaves.
No problem. Thanks for having me.
Thank you.
Great. It's an honor to have you with us today. Joan, you've worked with trauma survivors, from combat veterans to victims of assault to prisoners of war to first responders during the 9/11 impacts. The folks you've dealt with have dealt with amazing and incredible circumstances that are almost impossible to describe. What has drawn you to want to understand their stories? And what has drawn you to dedicate your life to post-traumatic care?
Great question. I wasn't initially, I didn't go to graduate school to work with trauma survivors. I always knew I wanted to do psychology to help make the world a better place, but I was interested in studying older adults. And my thesis and my dissertation were on older adults and Alzheimer's disease caregivers. And I happened to be assigned to a clinic in graduate school working with adult survivors of childhood sexual abuse. And when I was frightened. And I thought, I don't know if I'll be any good at this. But this was back before we had electronic medical records. And I went into the clinic and I read their charts. And they had 4 and 5 major diagnoses: major depression, anxiety, substance abuse. And I remember being scared. And then I met them. And I thought, there before the grace of God go I. Here were these people who were so pained, so deeply betrayed and pained, but working so hard and so resilient in trying to build their lives forward and heal forward. And I was so in shock and amazed and inspired and energized that I have never looked back. I've spent the past 20 years of my career working with trauma survivors.
That's amazing. You've helped so many people through the work that you've done, or assisted them in building the lives that matter to them, it sounds like, through understanding what they've gone through for themselves. And can you please tell us or give some examples of some of the common mental health challenges that people who've experienced trauma go through? And what kind of tools and strategies do you employ? What do you bring to bear to help these people understand and manage their trauma to thrive again?
Okay. So there's a range of mental health difficulties that people experience after exposure to traumatic events. And typically, the greater the dose of the trauma, meaning the higher the impact and the longer the duration, the more likely it is that they're going to have subsequent difficulties. So probably the difficulty or the disorder that's the most commonly associated with trauma is post-traumatic stress disorder. Which can be very disabling if not treated earlier. Depression, as I said earlier, substance misuse. A lot of times the people that I work with have PTSD, the hyperarousal, the re-experiencing symptoms, wanting to avoid thoughts, feelings, emotions, reminders about the trauma. And in an attempt to help themselves, they will wind up drinking alcohol or using drugs, which are a very effective short-term coping strategy. The problem is, in the long term, you have not 1 or 2 disorders, but you have 3. In addition to having full-blown mental health difficulties and disorders, people who've experienced trauma often have difficulties in relationships and trusting other people. They can have difficulties. So I think trauma changes the way we view ourselves, the way we view others, and the way we view the world. And so it can impact all areas of our lives.
Yeah, that makes a lot of sense. There's that saying, the burnt child fears the fire. Mm-hmm. If you've experienced a horrifying event in your life, you may likely be more, averse to circumstances that seem risky, and relationships are risky, in all ways, so it takes a lot to manage these things.
Especially if if it's an interpersonal trauma, right? Especially if someone has betrayed you or perpetrated something against you, unlike, say, like a natural or man-made disaster, which happens to a collective, but it's something like physical or sexual assault or even combat, especially if it's sort of one-on-one, it feels very interpersonal and direct. And those can be harder to trust others from, who either didn't protect you or meant to harm you.
Wow. Yeah, it's tragic what some people experience, but there is a lot of hope, and we'll talk more about that as we go through. With this, of course, is Darius Leonard. And Darius, I wonder if some of this might resonate with you. You know, mental health challenges do not discriminate. Everyone who lives today has experienced mental health challenge either themselves or in their family in one form or another. You grew up in South Carolina, one of many siblings. Can you please share a bit about your family story and your early life?
Like you said, growing up in South Carolina, I was one of 9. My mom had single parent, working 2 or 3 jobs, make ends meet. I had 2 older brothers that was incarcerated. Then I had one brother in 2012 who was, very close to me. He get killed at a bar. So, when I'm sitting here, I'm listening to, all the things that she talks about, with, people struggling, with depression, no sleep, can't eat, losing weight physically, and, just the mental part of it, just your mind don't go off of it. You think about it 24/7, that video that you saw of your brother or, everything, it just keep replaying in your head over and over so that, you're not getting no sleep. So, I mean, you just got to find a way to, to cope. You got to find a way to, to keep going. Because, I mean, my brother would want me to, to keep fighting. He wouldn't want me to, to sit there and act like, that I can't go anymore. So I knew what I had to do personally. And, I had to find help. I had to seek help, and I did. And I know it was the best decision for me.
It's beautiful that you remember your brother in a way that kind of helps you to move forward and thinking of what he would want you to do. I mean, that's just a tremendous thing to think of like that. And thanks for sharing about your experience this way. The loss of your brother, you were talking about that, Kivante, and the mental health challenges that provoked. So you say you began to talk about it and seek help for it. How long did it take you to start to talk about it, and how did you go about approaching help?
It took me it took me 3 years. He died in 2012, and I was having anxiety attacks, in and out of the hospital, getting EKGs. And then in 2015, my chest, wouldn't stop pounding. And then I got this EKG, and it said, you have an irregular heartbeat. And then I had, to go get an ablation done on my heart. And they said, it's because of a lot of stress. So that's when I knew that, I put my life at risk for holding everything in. So that's when I said, I gotta figure this thing out. So I talked to a specialist on South Carolina State campus. She gave me some ideas to help. And, so I took it. So I had to open up. My thing was keep all my emotions and everything inside. I had to be this strong, tough guy. And, I noticed that my attitude towards a lot of people, I had a short temper and I wasn't my happy self. So I had to find a way. So, I wrote poems for a long time. That's how I at first started. I was writing poems, letting my emotions go. And then I got to a point where I said, okay, I need to talk to my girlfriend that is now my wife. I got to let her know what's going on so she can understand. And then after that, it was, okay, now I got to talk to people who's dealing with the same thing. I need to figure out, okay, how do they cope with it? How do they do good with it? So I did that. And, ever since then, I've been feeling a whole lot better. I mean, I still have my days. I still have the times where, I'm in my corner, I'm in my dark, that dark room. But, I got to find a way to get out. And, I listen to music that my brother loved. I go visit him. And I just try to think of all the happy things that, that we did together. And, that brings a smile on my face. 'Cause I know he was a big, tall, goofy guy that loves to make people happy. So, I try to be that same person. I try to make everybody smile. And, that's the way, I was just brought up. So now I'm feeling a whole lot better. And I know that with my experience that there's a lot of people out there who's, been dealing with the same thing. And and they are afraid to open up and talk. So I know with me being in the NFL, playing the most dangerous position on the field, if I can go out and I can tell, okay, this is my story. Yes, I had a problem, but I had to reach out, and this is what I'm doing to work on it. I know there are going to be other people that are going to say, okay, if he can do it, I know he can do it, because it's okay to not be okay, and they got to understand that.
That's so beautiful. You talk about it sounds like the spirit of your brother is still very much alive in you, and you bring so much as well of your own self to the pursuit of helping other people feel like they're not alone, which is just amazing. Thanks for sharing that. So we're talking today about overcoming early trauma with Darius Leonard, a linebacker for the Indianapolis Colts of the NFL, and Dr. Joan Cook, who is a clinical psychologist and professor of psychology at the Yale University School of Medicine. And again, thank you so much for watching today and being with us. If you have any questions or comments you'd like to post in the webcast, please post them in the comments section today. Also, if you'd like to share any of the insights that we're learning today from Darius and Joan with anyone you know might benefit from these, please go ahead and share this webcast with them. We'd really appreciate that. Joan, back to you. Darius was talking about how it took him a little while to seek help and talk about his past traumas. In your experience, how long does it usually take people to start talking about their past traumas? And also, what kind of tools and strategies do you use to help people overcome their long-lasting scars?
So I think it depends. For most people, it takes years. When I said I came into the field working primarily with older adults, I sort of transitioned, worked with a number of older adult trauma survivors. And for them, that generation that in the times they grew up, they never said a word about anything, especially the ones who had been the men like Darius. And the men, I think, are socialized to, very much espouse John Wayne, right? And put it behind and move forward. And many of the World War II, the Korean War veterans, and even the Vietnam veterans that I worked with very much would try to do that. And so they wouldn't tell people for decades. And I remember when I was working at the Philadelphia VA, there was one gentleman, he was in his 80s. This was a number of years ago. And he was sent to me from the primary care doctor. And he came into my office and I asked him some simple questions about PTSD. And as I did, he wept openly. No one had ever asked him. He didn't know. And so that brief interview, which was just a little bit of education, which was like, no, these are normal symptoms, normal ways to feel after combat, and not talking about it for 60 years. So most people don't talk about it right away. I hope that's changing. I think, having done this work for so long, I was hoping that the events, September 11th, Hurricane Katrina, the wars in Iraq and Afghanistan, would sort of change the national consciousness and would help people realize that traumatic events are much more common than we know of, and that they really have an impact. And there's nothing wrong with having symptoms after exposure to a trauma. I think a lot of times people say to themselves, and maybe society tells them, there's something wrong with you if you have symptoms, you should be stronger, braver, you're weak because you have symptoms. And that's not the case at all. The fact is, most of these events will knock people down. And some people have a harder time getting back up, and that's okay. That's normal. And so what I say to particularly the combat veterans that I work with now, I had one guy last week just say to me, a Marine, who said, I feel weak coming here. And I said, I hear where you're coming from. I absolutely do. But I think you're stronger for coming here. It's the people who are less skilled, who want to bury their head in the ground. It's the strong that come forward, that say, I have this vulnerability and I need help. And I said to him, a Marine who had a toothache would not refuse to go to the dentist, right? And then wind up having a whole mouth infected in his jaw. You would go in for help. So why wouldn't you come in for mental health help and get stronger? And it's a matter of sort of working through. Does that make sense?
Totally makes sense. Yeah, it's great to know and to share that people who deal with these traumas and any mental health challenges are not alone, that, as Darius said, it's okay not to be okay. And that I've experienced this myself. When I was recovering from schizophrenia, when I was very sick, I went to this group therapy session and the therapist said that you're not weak for having your condition. You actually are doing the hardest work that there is to recover from what you've gone through, right? And so I think that's kind of the point. I mean, it does take a lot of strength and it's worth admiring to recover from a mental health challenge like that.
Absolutely. And I tell the people that I work with on a regular basis, they're the highlight of my week. I am inspired by their resilience in moving forward and wanting to live, more meaningful and happier and more connected, well-connected lives. So I think one of the questions that you asked me, Brandon, was whether we had treatments, and we do. We have a number of evidence-based psychotherapies for PTSD, for depression, for substance use, for the comorbidities. I think people don't really know about them, and they know they're available. Even, of course, during COVID, it's hard to get face-to-face mental health. We can deliver these therapies online or on the phone, and there are, free web-based, evidence-based interventions for people too that can access. And I can give you some of those if you want to put those on your website. But I think one of the biggest things I want people to know, and to echo what you're saying, is that people are not alone. There is help, and healing from trauma is absolutely possible and probable with good support.
Such a perfect message to share today. That's so important for people to know. Thank you. Darius, I wonder, does any of this resonate with you from your experience? Like your early circumstances and your emotional challenges. Do you find that perhaps having gone through that has helped you develop a strength and resilience that is now you can draw on it as you deal with this really mentally demanding sport of professional football, or maybe is it the other way around? Is it like your successes in professional sports and in college have given you the confidence to deal with the traumas, or maybe some combination thereof? What do you think?
I think, just like I said early on, my first brother who got incarcerated was in 1997. And, after that, my brother was incarcerated in 2010, I think. So just seeing all them early struggles, what the family had to go through, and then my brother in 2012, I just felt like, seeing my mom go through everything and keeping the family function and seeing how strong that she was, I knew right then that, I knew what it took. I knew what it took to, to have that strong mental capacity. And, now with, football, it is what it is. I mean, football is just a game. It's just, that's a small part of my life. And I don't think there's anything football wise for me to say, okay, my mental is all messed up. I felt like, everything that I've been through in life with my mom, my brothers, and my family, that just made me a better man. I like now with my wife, she's white. So, we had to go through some things from being from the South. So just everything I started early. Luckily I started early. Luckily, my mom and then my brother, who actually played football or played in the NFL, he taught me the way. This is what you got to do. There's going to be so many people in the world that's going to doubt you. There's so many people going to talk down about you. You cannot let that knock you down. You got to put up the wall, and you just got to build that wall as strong as you possibly can and prove them wrong and keep a smile on your face no matter what. Because now in this world, there's nobody really want to see you happy. Everybody in this world now, there's so many people who want to be in your spot, and they're going to talk so down upon you, not because of what you did, not because of what you say. It's only because of what you have. And you got to have that mental capacity in your head to say, I got to keep pushing, and I would never let someone talk down on me enough to actually hurt my pride or hurt my soul.
Yeah, that's such a great perspective. You keep your mind focused on what's really important. It sounds like your family, your wife, your father now, which I understand. I've read an article.
Yes,
that's beautiful. Yeah, congratulations.
Thank you.
Yeah. I love your perspective. And then, in addition to all the associated mental challenges with football, there's also the physically demanding and sometimes punishing impacts that happen being tackled and tackling. Do you ever have concerns about traumatic brain injury and the mental health challenges that might arise from that in later life?
Of course. I mean, especially I've been playing this game since I was 8 years old. I've been taking hits, and now playing at the top level. Now you have them thoughts, and especially when you see the two cases of the NFL guys, either, finding one of them dead in Tampa in his room, and then the other one, killing the doctors and everything. You have it in your mind the whole time, and you figure out, okay, do you continue? You want to do this, so you think about it, but then you got to figure out, okay, how can I prevent it? There's doctors out here, there's so many things that you can do, like stem cell treatment, stuff like that for your brain. So it allows you to, as you beat down your brain, it actually helps you build it up. So, I mean, you have the thoughts. I mean, you got to, because it's real. Just like mental health issues is real. So you cannot be blind to the fact that there's a high possibility of CTE, you know, so you got to make sure that you're preparing the right way. You got to know how to tackle. How can you take your head out of each tackle? And then if you feel a headache, you cannot say, okay, I'm going to be this strong guy and say, okay, I'm going to fight through it. No, you got to go to the doctor. You got to say, okay, I don't feel right. You got to tell them that, you know, your head is hurting. You got to make sure that you understand that. So then later on in life that you'll be able to, you know, be there for your child. You know, you want to be able to go outside, play with your child, be there every step of the way. You do not want to be a robot or anything and not be there for them. So you have it on your mind, you think about it 24/7, and you got to realize is if this game gets to a point where you really can't take it, you got to hang it up no matter what anybody say to you, because you only get one brain, you only get one body. And a lot of people might say, you know, you retired early or whatever. It is what it is. You got to make sure that you're okay, because 9 times out of 10, they're not feeling the same pain that you're feeling.
I love that. And we're the best judge of our own, you know, state of health internally. That's a great perspective. And yeah, thanks for sharing those suggestions for other football players to understand. Thank you. And people in general too. Joan, is one of the things you see with survivors of trauma that their experiences help them thrive in other areas of their life? Giving them if they can learn the skills to cope and manage their mental health and understand the trauma they've experienced?
Yeah, I think there's a unique, you know, concept of resilience, which is about, you know, bouncing back. And some of us after a traumatic event bounce back relatively quickly. And we're still trying to figure out all the reasons why that is. Some of it's having social support or family support or religiosity or things like that sort of protect you. But for a lot of trauma survivors, even when they experience deep despair or suicidal ideation or depression and PTSD, there's still a resilience that they keep moving forward, right? And sort of, if you want to think of it as sort of like a grit, that nothing, you know, shall break them and they will keep moving forward. Absolutely do I see that. I say to the patients that I work with, especially when they're feeling, you know, down and out, fall down 7 times, because we all fall down, and get up 8. It's about picking yourself back up and moving forward with the support of friends and family and church and, you know, your social relations and formal mental health treatment if you need it. And some of us really could benefit from it.
Yeah, that's amazing. And Darius models that so well with what he described, how he handles the trauma he's experienced. You know, Darius, May is Mental Health Awareness Month, and you're part of an amazing initiative that the Indianapolis Colts has launched, one of the highest profile mental health initiatives in all of professional sports, the Kicking the Stigma campaign. This is just incredible. Why did you feel it was important to speak up about your mental health publicly and be one of the faces of the campaign?
Just because of everything that I've been through, you know, and like I said, in 2015, that's when everything, you know, hit me in the face. Like, okay, you need some help. And I know there's a lot of people out there who's afraid to even say anything, because they're going to say, okay, you're weak, you're not strong, you're showing signs of weakness. So I know if I can do it, I know there's so many people going to say, okay, if he can do it, I can go out and you know, be able to reach out for help. And if I got to be on the front line for it, I'm there every step of the way. And I'm very thankful to be with the Colts organization, because there's not our organization who actually care about the players or care about, you know, mental health. And, you know, I thank the Irsay family, you know, almost every day for allowing me to be a part of the Kicking the Stigma campaign.
That's tremendous. And you really are inspiring so many people out there through your example. So that's something to feel great about. Thank you.
May I ask Darius a question?
Yeah.
I sort of wonder, like, what is it going to take to really put it into perspective that it's not sort of a weakness for the public? I mean, do we need to help them understand that at least 10% of Americans have full-blown depression at any one time, 20% over the lifespan, that the rates of anxiety disorders per year is 19% of adults and 30% over their lifspan? Take those numbers and put those together, and then put other things. The vast majority of us, if we have not had these struggles, we have family members or friends or colleagues who do. So when so many of us experience it? How do we still have that stigma? And how do we break
the problem? Me personally, I think the problem is, you watch TV shows, but you don't I don't see enough on the news or anything. I don't see enough of saying it's okay about mental health. I don't see enough shows to say, okay, I don't feel like a lot of people talk about it. And then when they do talk about it, they talk about all the negative side. Like when you see the mass shootings, they say, he was mentally struggling. So in their mind, okay, I can't say I'm mentally struggling because then they're gonna think that I'm a mass shooter or something like that. And then when it comes to a profession, I think the owners of that profession need to say, okay, how's your mental? I'm not asking you this to say, okay, if you're saying you got a mental problems or you're stressing, I'm not saying it because I don't want you to get this job. I just want to know as a person who I'm getting, how can I help them in a way? Because in the NFL, we've been asked a million questions, but not one question was asked about how's your mental, and how's everything at home. Everything was all football. And we felt like if we said anything negative about our mental or anything, we felt like, okay, our stock would drop. So yeah, me personally, if we see more things on TV, more shows, more people actually sitting down, talking about it and letting people know that it's okay. And when it comes down to a job interview or anything, allowing people to be honest about themselves, then I think that's when everything will come out. Because as of right now, I feel like jobs are so stressful and people are afraid to say, hey, this is what's going on with me. And then you look at it with Kyrie Irving, the basketball player for New York Knicks. Every time he feels something, he shut down. And every time he shut down and say, okay, I need to take a mental break, he gets so much criticism saying, okay, what are you doing? Like you're supposed to be playing basketball. And that's the mindset that you see day in and day out all over social media, all over the internet. So when people sit down and talk about it and really understand that it's okay that you're stressed, it's okay to be depressed, I think that's when we're going to be in the right direction.
So rather
that's fantastic.
For the public to see it as a strategic recharge, they see it as a weakness, having to take a breather.
Yes, it's really important. The campaign, like the Kicking the Stigma campaign, the Colts are doing, and Darius is the face of in so many ways to help the people understand it is okay not to be okay. Thank you for all that you've shared there. It's just so important for people to hear. Now we're going to come to the fun part of the show. It's all been fun, but this is the most fun part of the show, the lightning round. Okay. So I'm going to ask each of you 5 quick questions, and I'll ask for very quick answers from you to take 30 seconds in total for the questions and answers for each of you. Okay. We'll start with Joan, then we'll go to Darius. Sound good?
Yeah.
Okay. Ready, Joan? All right. What helps you cope when you're going through a tough time mentally?
Thinking of the people that I work with and how hard they try, and if they can do it, I can do it.
Oh, I love that. What song or type of music do you turn to when you're feeling down?
So I'm originally from New Jersey. I'm all about the boss. I live my life according to Bruce Springsteen. I love his song, "The Ghost of Tom Joad." It is my calling.
That is such a profound song. I love it too. What is a hobby or activity you do to help you unwind and de-stress?
I read all the time. It immediately relaxes me.
Yeah, that's great. Puts you in another space.
That's why I'm an academic too, Brandy.
What's one thing you've never told an interviewer about yourself?
I'm not telling you my age. Don't figure it out.
21.
I'm Darius times 2.
And what gives you hope?
People like Darius. The Colts for doing this show, and all of us working together as a collective to build each other up and to live a different life.
God, that's so wonderful. Yes, perfect message. Thank you. Darius, your turn. What helps you cope when you're going through a tough time mentally?
Music.
Mm-hmm. And specifically, what kind of music or song do you listen to when you're feeling down?
It got to be 90s R&B. It got to be, something like Kiki Watt, my first love, just music that speaks happiness. And, I love being a loving, caring person, and music that shows love or sings about love, just brighten up my day.
Right there with you. What is a hobby or activity that gives you the ability to de-stress and unwind?
I say shoot basketball.
Mm-hmm.
Just being around, that was my first love. And me and my brother, we played basketball against each other day in and day out. And, just being out there, shooting basketball, it just, released every stress that is on my shoulders at that moment.
That's so lovely. And what was one thing you never told an interviewer about yourself?
Oh, let's see. Maybe I love to babysit.
Love it. You're such a great guy. And what gives you hope?
Gives me, my mom. She's been through absolutely everything. She lost her mom and dad. She got 2 sons incarcerated, 1 dead, and she's just, as happy as she can be day in and day out, trying to go out and help everybody. And I know if she can have all this pile of stress on her, been through what she's been through, and keep a smile on her face, I know I can do the same.
Wow, what a lady. I'd love to meet her someday. She sounds incredible. Thanks for sharing, Darius, and thank you, Joan, for sharing your expertise and your great wisdom, both of you. Thank you both for being on the show today.
Thank you.
Thanks for having me.
You're welcome. And viewers, thank you too for watching and participating today. If you would like to stick around for a moment, we're going to share a great review from our Unwind Cyber Guide team on an app that uses a game and evidence-based principles to help children who've been through trauma understand their thoughts and feelings around the trauma they experienced.
Hi, my name is Martha Neary, and I'm the project manager of Unwind Cyber Guide. At Unwind Cyber Guide, we provide advice and guidelines to people who are interested in using mental health apps. Mental health apps can be a great tool to add to your mental health toolkit. Research has shown that apps are especially helpful when used as an add-on to traditional treatment with a licensed provider. In one study, which looked at apps to help reduce depression and anxiety through skills-building exercises, participants saw benefits from using the app for just under 1.5 minutes each time. This suggests that even using an app for a couple of minutes each day might be helpful for you. Most good habits can take a little while to form. Building the use of an app into the daily routine that you already have may help you use it in a more sustained way. For example, maybe you brush your teeth and then use the app, or use it after dinner. Most apps also allow you to set notifications, which can be really helpful to remind you to use the app regularly. TFCBT Triangle of Life is a game designed for children who've experienced trauma. The app is based on trauma-focused cognitive behavioral therapy and evidence-based treatment. Users help different animals solve problems and understand the connections between their thoughts, feelings, and behaviors. Through using the app, children and adolescents may build social and emotional skills by better understanding the feelings of the characters. The app also teaches different ways to address and solve problems. The app is aimed to help users between the ages of 8 and 12 years and is designed to be used alongside a therapist or mental health professional. On the Unwind Cyber Guide app guide, TFCBT Triangle of Life has a score of 3 out of 5 for credibility and 3.79 out of 5 for user experience. We also have a professional review of the app by Lauren Sherwin, which highlights some of the pros and cons and gives some recommendations for use. We look forward to seeing you next week for another app review.
Thanks, Cyber Guide team. Thanks to FJØRA, Darius, and Joan for being on the show today. Viewers, thank you too. Please check out any and all of our past Brainwaves episodes on onemind.org/brainwaves. Look forward to seeing you next week. Thanks.
Every day trying to find the strength. I just want things to go back to normal.
Science is racing to find treatments for the virus. Vaccines are on the horizon.
I don't know what to do.
But what about the mental health research needed to sustain our lives during and after the crisis? Unmind is funding the science to revolutionize treatments and provide hope. Unmind, accelerating brain health for all. Help us fund new treatments at onemind.org.